We have with us Madam Dr. Sumanta Tripathi. She is Professor of Botany, a great scientist, great botanist, working on usage of herbal plants, herbal medicinal plants in the cancer treatment. She will be reporting the whole this session. Here I would like to mention all the repertoire of the different sessions. They will be considered as the chairpersons. They will also be given the certificate and memento as they be given to the honorable invited speakers. So, Madam, on behalf of the society, on behalf of the organizing committee, I do welcome. I do understand your busy schedule. In spite of that, you have made it convenient to come over here. On behalf of the organizing committee, I welcome you, ma'am. If my faculty members of the department, they are online, I would request all the faculty members, you are supposed to reach here at 9:30. Please do come to the auditorium. Honorable Minister Sri Gajan Singh Shekhawat has given his kind consent to be with us in the validity function. Honorable Chairperson of the Society, Indian Society for Radiation Biology. I can see very young chaps are here. I would request you to all kindly get the membership of Indian Society for Radiation Biology. The concession will be given to all the members of the ISRB during the next conferences. Once in a year, we organize national conference, and twice in a year, we organize international conference. So you will get all the information. Ask your colleagues, your teachers, your friends to become the life member of society. The fee of life member is only 2,000 rupees, which is nothing in present days. Life membership, you will give a life membership card. Your names will be mentioned on the website of the society. Really, you'll enjoy. As Professor Eva Bijak yesterday, she intimated you all that you have a very bright future in the field of radiation science. This is third time Bikaner Government Dunga College Department of Geology, under the auspices of Indian Society for Radiation Biology, is organizing the third international conference. It was supposed to organize in the month of October 2020. I got the confirmation from the around 40 countries. All delegates, they were supposed to come over here in the Ravindra Manch. I had booked also. Due to COVID pandemic, we had to postpone the conference. Now, we decided in the time of the modern time of technology, some of the scientists from the New Delhi, they said they were telling, we were not supposed that Dunga College will organize in such a nice way. You can see the technology, person sitting on the United States, he is with us, sitting in Australia, in Germany, Japan. They all have joined us and you all have witnessed. Ladies and gentlemen, one of the speakers, they are on the way. So once again, I would request you all to Dr. M.D. Sharma, you can have.
Dr. Purohit, I am online.
Yeah, Dr. Bhupinder.
Yeah, I am online.
Are you online? Well,
yes.
Wait for 2 to 3 minutes.
Okay.
Our honorary principal and the many other deans of the faculty, many head of the departments, they all are gathering in the auditorium.
Yeah, kindly let me know.
Yeah. Please
okay.
Be online.
Okay. Thank you.
Very important sessions. Around more than 1,000 student scientists from India abroad. They are live on YouTube. Many invited speakers. They have joined the conference online Zoom meeting. Dr. Bhupinder, you have the schedule of today? today's schedule, I think.
I have the schedule.
Okay,
I have the
okay,
schedule.
okay. Thank you so much.
Maybe before we start,
how's your health, Dr. Bhupendra? How's your health now? Are you comfortable?
I'm good. I'm good. But maybe joining the office tomorrow.
Okay.
It is unfortunate that I couldn't make it to your conference.
We missed.
Such a great conference. I have been a part of it since day one. The cultural program performed,
Yeah.
and how your students did it. Excellent program.
We
Excellent.
missed you, sir. In future also, we will invite you to give a talk offline in our college. We would like to hear.
I felt
Really,
this was a great opportunity for all of us to be together again, but somehow we couldn't make it. It's really unfortunate. I call myself the unfortunate one for not being able to be there with you all.
Respected sir, your health is on utmost priority for we all. Your health is on utmost priority. I am very happy, in spite of your health, you have given your kind consent to be the chairperson of the very important session of the conference. Ladies and gentlemen, let us start the session 7th. Sir, I would like to mention here some of the speakers, they are from physics background, one or two background, and some other speakers, they are from the Rajuvas. Sir, Rajuvas is the Rajasthan University of Veterinary and Animal Sciences. The professor and head, he is also a second speaker, Dr. Parveen Vishnoi. He is the in charge of radiology. They use the radiation instruments for the treatment of animals, pet animals rather. And next speaker, Mr. Sakar Palicha, is also professor of veterinary sciences. First speaker, the great scientist, the man of physics, Dr. Anami Bhargav. He has a very nice contribution in the field of radiation science. He will be our first speaker, and your collaborative, your co-chairperson, Dr. M.D. Sharma, is professor head Department of Physics, great scientist, the most active person. He is one of the vertebra of this ICRB. So I would not stand for longer time in between you and the speakers. I would request, first of all, Dr. M.D. Sharma, professor head Department of Physics. You come here. Okay, you come here. The report will be there. Dr. M.D. Sharma will be on the dais. Sir, please up. Yeah. This yellow. Yellow. You call this mic. You call this mic. Call the mic. You too. The man of physics, Dr. M.D. Sharma, professor head, Department of Physics, Government Dungal College, Bikaner. Dr. Bhupendra Singh, also from great scientist from New Delhi. Rapporteur, Dr. Sumalta Tripathi, professor of botany from our college. She has a very nice work on the use of herbal products in the treatment of cancer. This is one of the theme of also. Dr. Nendra Bhojak will be our fourth speaker. He is the director, Green Chemistry Research Center of Dungal College, Bikaner. He is looking after all these online process of the international conference. Our ex-head of the department, Dr. Meera Srivastav, you might met her. She will also be our fifth speaker. So I would request Dr. M.D. Sharma and Dr. Bhupendra Singh to start the first session. Thank you very much. Thank you.
Thank you, Dr. Purohit, for giving us this opportunity to chair the session on radiology and radiophysics. I along with my colleagues, Dr. M.C. Sharma, and our reporter, Dr. Suman. Dr. Suman. I thank, we welcome you all to this session 7. We have some very interesting talks lined up for today, starting with radiation for radiation-induced effect in materials, with the radiology in veterinary sciences to CT applications of in small animal diagnostics, to very interesting topic, green chemical biotechnology. And we will end up this session with a talk by Dr. Meera Srivastava on electromagnetic radiations as a emerging cause of insect decline. All the speakers have been given about 15 minutes, and I will be requesting, I think my co-chair or chairperson, Dr. MP Sharma will agree that we should request the speakers to finish their presentations within 12 minutes so that we have 3 minutes of discussion and question answer session. Over to Dr. MP Sharma, please.
Now, on the third day, since the 11th session we are going to step in, the first speaker for today is Dr. Rani Bhargav. He will be giving his talk on radiation-induced effective material using positron radiation. He has been doing a lot of work in nanophysics, particularly photonic systems. Got his MSc early in 1987 from Positron University. In fact, he was nominated for British Government Commonwealth Fellowship in Physical Sciences in Canada by Ministry of Human Resource Development in 1995 to 96. Then he joined his college in 1995. He has been and he guided 15 students for their MPhil work. I invite Dr. Honeybees Bhargav to start his talk. Dr. Honeybees.
Thank you, Dr. M.B. Sharma, Dr. Bhupender Singh, and the rapporteur, Dr. Sumanlata Tripathi. Special thanks to Indian Society for Radiation Biology and ICRB Executive Committee for inviting me to deliver this talk. Okay. So, the topic which I have selected for this conference is a very elementary one, and it's basically focused on young researchers sitting over here, and the MC students, PG students, and people who are just joining the radiation biology or radiation chemistry and radiation physics. There are three branches which I will be addressed to, but mainly I will be focusing on the physics aspects of the radiation, which is radiation physics, and what these radiation really correspond to, because there is a misconfusion, lot of confusion in when we assess the poster sessions regarding the radiation. Mostly the people refer to as a gamma radiation or some sort of a mobile tower, which is electromagnetic radiation. So let me start my talk. The topic is the radiation-induced effects in materials, which basically the matter we are concerned with, including the human bodies. We are all made up of atoms and molecules. So the theory, the principles which I am going to outline equally holds good for humans too, besides the solids and the other fluids. So that's my name, Anand Bhargav. I run a small lab, nanophysics lab, doing a small work in non-crystalline and nanocrystalline materials. And some part after my PhD, I did on the positron annihilation technique, which I will be describing here. Now, why this talk? There is this field, radiation physics, chemistry, and biology. They are interlinked, and people who are doing work in nuclear medicine, they know how to use these all three techniques together to use it and correlate with the results which they irradiate the samples or whatever they're doing. So there are two concerns which I have. So first is to evaluate and interpret the radiation-induced effects in humans and materials. And secondly, which is very important, when you irradiate something, you need to have some protection principles for to be given to the patients or the materials for the shielding for the rest of the material so that they do not get affected. Now, primarily my talk will be on three terms: the radiation, materials, and the positron annihilation, the third one. But radiation to common people is something like which I've discussed, told earlier. It is something like mobile tower radiation or gamma radiation from the Tulsi Cancer Research Institute or some other institute. But that's not all. Any energy, form of energy is also radiation. So even uh, it's thermal, it could be any other source. So in physics, we generally talk of the excitation of the atoms or nuclei, and then whatever the energy is emitted or absorbed in the form is just the radiation. So even a particle is emitted with some energy, it is also a radiation. So on that basis, we have electromagnetic radiations, which we are all used to. Radio, microwave, IO, terahertz is a new field which is coming up right now, and it has medical applications. Then we have visible, even what we see is also a radiation. UV is well known. X-rays are very much used and reflects the medical physics also. Gamma is also known, but there's particulate radiation, such as the proton, and you have neutrons, alpha particles, and beta particles, with like things like positrons. These are much more useful in analyzing and using in the diagnostic tools. Now, what is the source of basically radiation in on the Earth? So mainly radionuclides, some minerals which decay spontaneously, and there is radiation from the suns and from the cosmic ray showers from the outer space. Then we have thermal sources. So these are all, even the radioactivity which we are used to and known and users of, it is also natural, occurring in nature, and artificially made in reactors and the machines. Humans, we also radiate. If we consume food and some other materials, minerals, through some other means, then if they are radioactive, then we also become radioactive persons, people. So that is also a source sometimes which inflicts your health, and it inhibits the growth process. Now, what are the sources? Mainly, we know that matter, it's generally made up of molecules and atoms, and then you can break up to go up to nucleus containing neutrons and protons. And so if you have a sufficient number of neutrons, excess number of neutrons, you can destabilize or make the nuclei unstable, and then you get some rays which we are known as alpha, beta, and gamma rays. And but besides that, in radioactivity, you also get protons and neutrons, which are very energetic, and they can damage, which is called the radiation damage in materials. And electrons also, if they are raised to high energies, they are also damaging the system. So on the basis of these particles, those are charged, we call them as ionizing, and those are not charged, we call them as non-ionizing radiation. So most of the research, these people in radiation biology and medical physics and nuclear medicine, they are using ionizing some part and not the non-ionizing. So mobile tower is providing you non-ionizing radiation. It's not ionizing, so the effect is very small. The damage is mostly concentrated with the ionizing radiation, and I will tell you how this occurs. Now, how does these particles interact? Once produced, so light charged particles, we have electrons and positrons. Positron is an antiparticle of electron having same properties, except that it has a positive charge and some of the quantum numbers which we know in chemistry and physics, they have opposite quantum numbers. So being charged, they will interact with the matter. Even human bodies, which contain lot of electrons and protons. So these light charged particles, when enter a medium, even in body, they will interact through the Coulomb interaction, because it is a charged one, Coulomb force. And due to this, because there is a large number of electrons available in the system, so there is large angle scattering, that is the deviation from its path, and some of the collisions which occur during this. During this collision, an elastic collision occurs, and in some cases it can take out some of the bound electrons or displace them into other orbits, and so large amount of energy can be transferred, so that there will be excitation, or there will be a formation of an unbound state. In both the cases, we have ionization, radiation, which we are all using in the medical physics. Now, these inelastic collisions, they will, besides this, there will always be a radiative collision, in which there will be, it will be interacting directly with the nucleus and giving off radiation, which is called bremsstrahlung. And all these techniques, these particles are used in medical diagnosis and treatment of diseases like tumors and cancers, even in lung diseases and brain and heart. These are the particles which are generally used. Now, there is a small contribution from the elastic collision of electrons also with the nucleus, and it is deflected. The electron is deflected without any excitation or radiative loss. Okay, there is a small particle, multi-particle scattering, but we are not concerned with here. It occurs only for high-Z particles, the absorbers which are lead. Now, if someone is planning to do an experiment using these electron beams or positron beams, the quantity which one must inquire into is the intensity of radiation, and the equation is simple. I is equal to I0 e to the power of minus mu x. This mu is the factor attenuation coefficient, which each skin or material depth has a material property. So you have how much depth the particle can go is decided by this mu number, which is attenuation coefficient. In bodies, this is also, people are using it as a mass absorption coefficient. So per kg or per gram, how much the particle, the radiation is entering your body, that you can also estimate using the relation. The behavior of positron is almost the same, except that there is, because of its positive charge, when it enters the body, it interacts with the electrons, and once a positive and a negative charge interact, they will annihilate and giving rise to gamma rays, or which are simply photons. So now there is another part which is very important, and second is the heavy charge particles, which are produced generally during the artificial or natural radioactivity, and they are basically protons and alpha particles, which are generally helium nuclei. So these being heavy, they lose energy very rapidly inside them, and within a small range at depth, they just annihilate themselves. What it is used in presently in a new therapy, which is called proton therapy, which is just developing right now for using the proton beam. So that is one of the principles of using this concept in the proton therapy. So secondly, in the kinetic energy loss is also in the absorber takes place through the electromagnetic interaction, being the charged particles. Both of them are charged particles and heavy charged particles. They altogether mass. So they rapidly lose their kinetic energy and slow down, right? So on that basis, when the atom or the material absorb this energy, they will be raised to higher levels and the material can become radioactive. So this is the basic process by which these heavy charge particles also interact with the. And the third important part is the how much is the energy loss per unit of the thickness of the material. So whether you are taking human samples or general materials, this holds good for both of them. So if you have an energetic monoenergetic beam, that is a single energy beam of proton or alpha particles, then they will pass without changing the concentration, the number of particles. So that is the concept which is used in medical diagnostic techniques using these proton or alpha. It is a costly affair because you need to have a very high collimated energetic beam of protons, and proton, the advantages is that it does not decay further. Just like an electron, it does not decay further. So it will not break up just like a neutron. Neutron breaks up into a proton and an electron and a positron, but a neutrino. But that is not happening with alpha. Now we have massive neutral particles also, neutrons, and these neutrons are also used in several diagnostic techniques, just like protons and neutrons, but neutron scattering, it is uncharged particle. So it behaves very differently. It is not detected in any instrument directly. So there is a secondary process by which the neutrons can interact and give their results. So one is that electromagnetic interaction will not take place. They will interact only through the nuclear reaction. And therefore, in all nuclear reactors, you have neutrons sitting, which they interact and bombard, and then they will produce the radionuclides or other materials. And subsequently, when the nuclide is formed, a daughter nuclei is formed, it is always in the excited state, higher end state, and therefore, there will always be a gamma successor to the neutron radiation, right? So that is the, so neutrons can, the use which are used in these reactors or instruments, they can be slow, they can be thermal, they can be epithermal, depending on the energy range up to 1000 electron volts. Then you have intermediate neutrons energies, which are also used. And then you have fast neutrons, which are very damaging. So, right. Now, massless particles, which we are used to and very well known, gamma rays and X-rays. These particles basically are photons, we know, and these, when enter a medium, they are absorbed by the material, but they have the property that they are transmitted through the medium. They cannot be stopped. So unless there is a high Z absorber like the lead, you cannot stop gamma rays from the, okay. But in a homogeneous material, you have this quantity, which is again the attenuation coefficient. And if you have a defect or inhomogeneous material, then it will always show a difference in energies which are picked up by the detectors. And then you have imaging. The CT is using X-rays, the positron emission tomography. The basic principle lies in the positron emission. So that is also using this attenuation number to reflect the data. Okay. The key main processes by which I will just, because I have to come to the positron also. So I'm just brushing it up. So the three processes mainly which gamma rays interact is photoelectric effect. People might know from the even class 12, they are putting in the course. So Compton effect, and then you have wave production. There are three processes mainly which the gamma interacts with matter in all cases. So one must include this part in research when analyzing the results and what sort of energy they are putting in and what is the outcome of their research. Now these are, this is the block diagram of the radiation sources India provides to researchers. And there are certain labs, the light charged particles, you can use it from the synchrotron radiation, and then you have betatron and LINAC. Now, LINAC and betatron, they are available in most of the research institutions. LINAC is here also in the HRF Tulsi Center. It uses an electron beam. So you need research for using electron beam, you can use this. Then there, indoor, CAT indoor, you have synchrotron radiation, which are energetic electrons which give off radiation, and you can use it for your research. 5 minutes. Energetic sources, we have proton and alpha sources and ions, which you can use using IUAC, ion implantation and palletron facilities. Then you have cyclotron and Mendeleev conductor. It's available in the VII, Calcutta. So you can use this for research purposes. And neutral, these particles, neutrons, they are available in small seed sources also, reactors, and the Dhruv reactor at BARC. No, these I will skip. Now, this is the basic process through which the energetic particles, they interact with the material. Once it enters, it conflicts with the interfaces. Then if it's sufficient energy is available, and it will pierce into the material, displaces the atoms and produce some voids also. Otherwise, they will interact with the interstitial space, or they will interact with the monovacancies, the divacancies, and the grain boundaries, which are created naturally or during this ionization. Positron annihilation, basically, even in the positron emission tomography, you have a radio tracer, which is put inside the body. And as the positron moves inside the body, it searches for the localized regions, the lesions which you are searching for, even in lungs or even in the body. In the whole body scan, you can have these lesions, even of very small size. It will find the density variation, which corresponds to electron density. If there is a feeble electron density, then it will annihilate there the positron, and it will give rise to gamma rays. And then you have detectors sitting over the human body or sample, whatever, we have solid samples, but that detectors will count the number of gammas emitted, and they will correlate the energy by which it is emitted and the emitted from the positron annihilation. And there is a correlation, strong correlation. If there is a large defect, then it will give rise to a hydrogen-like state, which is called positronium. 3 gamma state is a triplet state, and the 2 gamma state is a singlet state. Okay, so that is the chemistry people also know this. So you have a lot of positron sources. It might be available here also. Sodium 22 we have in the lab, strontium, yttrium, and C14 and RAD. These are all sources which have. Cobalt 60 is a gamma ray source, but it's also a positron source. So every alpha ray source or positron or proton, they always provide gamma rays also. So that is the requirement for shielding from gamma rays once you use these ionizing radiation. So I will just skip, but the basic process of interaction is something like this. If you implant a body or a material with the positron, then it will slow down, thermalize, and then because of the ion cores which are positive in the crystal lattice, there will be repulsion. But if there is a void, or there is an interstitial space, or there is a monovacancy, or any other type of defect, it will see an electron density there, and it will search for it. So it will take a path. It will take time. So whenever there is an absence of ion core, what happens is it will give rise to a negative energy. So it will be trapped there, and after some time it will be releasing 2 gamma rays or 3 gamma rays. That is the basic process of even positron emission tomography and the positron annihilation tomography, which we have studied in our earlier research. Okay, I will just wind up. That is the basic process. You can use a picture. Okay. So that is the basic process. I will not describe it. It's self-explanatory. You can use these gaps or the depth, how much 10 nanometers to 100 nanometers, these positrons can access. And you can, I will show you, this is the diagram, which is very useful for these young people who are venturing into their research. That when you have a defect size or you have a lesion region, something like 1 nanometer to 10 nanometers, you have positron annihilation or positron emission tomography, which can detect a very early stage of a cancer. So that is the importance of this. And even the depth, you have a very small depth which can be assessed. Okay, I'm just winding up. This is the basic beta decay process. There will always be a gamma ray, so that is killing you. This is the setup which we use, and which I have described. There are 2 gamma ray detectors, and then you have a computer assisted system to measure the lifetimes. So depending on the lifetimes, you have a whole CT and PET CT generated. So this is the simple thermal neutron source which we use in simple americium beryllium source. And these are results. These are the graphs which we use in experimentally when you do a lifetime experiment. In CT and PET CT, you generate lakhs of such diagrams to make an image and then present the results. So in 1 second you can, because the lifetime, they are coming in picoseconds, so 10 to the minus 12. So you can very well assess in 1 second, you can have how much the number of images we can generate using this technique. I think I should stop here because time is slot is a problem. We are going already late. So thank you very much. Any questions?
Thank you, Dr. Ravi, for your very informative lecture. And you have proved that how physics is important and playing an important role in the field of radiation biology. I switch over to Dr. Vendasangi for his comments. If anybody is interested.
Dr. Anami Bhargavaji, thank you very much for an excellent presentation. In fact, also for highlighting that radiations are commonly understood in terms of the gamma and X-ray, which we normally come across. And presently, everyone is little bothered about this mobile tower radiation. One of the speaker also is going to talk about it. And also for highlighting the usefulness of positron tomography and other applications and how they interact. It was such an excellent highlighted presentation for all the students and everyone. Probably there was something for everyone to learn from your presentation. I just want to have only one question to you. You mentioned in your presentation radiation damage in materials, but is it that the radiation always damages the materials, or because we understand that radiations also have we can also bring positive changes or the required changes in the materials. So what is your take on that? And then following that, I think Dr. M.D. Sharma will open it for everyone. And I will request all the speakers to kindly stick to the time.
Okay. Small. Actually, in some of the materials, which I couldn't show the slide of graphite, which I measured, because graphite is important these days due to the production of graphene, which is revolutionized the industry in the next 20 years. So in graphite, what we have found is when you irradiate it with the positron, the light electron density is also increased, and that way the defects are removed. That means the unwanted part of the crystal, pure crystal or material, can be eliminated using these positron annihilation, even gamma ray, if it is controlled in a better way. Even that happens with neutrons and even with proton, because proton therapy is based on the same concept, which you have at different depths, revealing different kind of regions for an energy, so that a depth profile can be analyzed and treatment can be given.
Okay, thank you, Dr. Anami. Over to Dr. M.D. Sharma, please.
Thank you, sir.
Thank you. Thank you once again, sir.
Dr. Asif Roy wants to say something.
Ladies and gentlemen, I would like to request all the audience to remain available in this auditorium. Honorable Central Minister Mr. Gradation Shekhawat, he will be joining we all at 1 p.m. Honorable Vice Chancellor of Native Dream 2 University, the Chief Guest of the Validity Function, Dr. Satish Bhandari, he will no more be available after 1:30. So we have to start sharp at 1 p.m. the validity function. All the honorable speakers are requested to be still time. I would request the chairpersons to be still to the time. Thank you very much.
Okay, I think now we have all heard Dr. Purohit, and may I now invite Dr. Praveen to talk about radiology in veterinary sciences. My humble request to Dr. M.D. Sharma is that, when the 12 minutes are over, kindly instruct the speaker to come to the conclusion slide, and also request to the speakers to finish the presentation. Don't lay overemphasis on initial slides. I think you know better, and come to the point which you want to focus upon. Thank you very much.
Thank you, sir. Now I invite Dr. Praveen Bishnoi, who is Professor and Head, Department of Veterinary Surgery and Radiology, College of Veterinary and Animal Sciences, Rajwa, Dr. Bishnoi, please proceed. He has been member of Academic Council. He did his PhD in 2001. I invite Dr. Praveen Bishnoi.
Thank you, sir. Respected Dr. Bhupender Singh ji, Dr. Sharma, Dr. Somlata, the organizing committee, I thank on behalf of Rajivas and on behalf of myself for inviting me to this prestigious conference. And nowadays, when everybody is talking about One Health, so the all the disciplines, they should come together and work hand to hand for the betterment of the society and for the betterment of the health. Okay, starts. Actually, my topic is not directly related to the theme of this conference. So I'm just giving a brief of what we are doing with radiology in veterinary science, because although we are not at par with medical science or medicine in the use of radiobiology or radiation therapy, but still in the diagnostic imaging, we are not very lagging behind with the medical. So as you know, there are two aspects, diagnostic and interventional radiology. And it is the diagnostic imaging, it is an integral part or a very important part of the veterinary medicine. This is the what the earlier speakers must also have thought, that what the Ranjan started as production of X-ray, now it has traveled a long distance, and now we are using many of its applications in various aspects of imaging and treatment. Then in veterinary field, the radiology is the only branch for decades which radiography particularly, which has been used for the imaging in small animals all over the world, and in some part of the world they are using the radiology in horses. But in India, particularly in veterinary colleges at Hisar, Ludhiana and Bikaner, we have been using the radiology in different animals, in cattle, in buffalo, in camels also, for diagnosing various aspects. So for that, I'm just showing a radiograph. This is a condition of diaphragmatic hernia. It is very common in buffalo. The medical people, they must be knowing that what is diaphragmatic hernia. There is a diaphragm which separates the abdomen from the thorax, and at times some vent is created in the diaphragm, and a part of abdominal organ, it herniates into the diaphragm, and this condition is very common in some animals, and buffalo is one of them. And we are diagnosing this radiographically. You must be knowing that a buffalo weighs around 450 to 500 kg, and the girth of the a buffalo is around 250 centimeters. So with that much width of the abdomen and the thorax, we are still able to take the radiograph with the limited power of our machine. We are having here 500 ms. Some of centers, they are having 100 ms X-ray machines, but still we are able to diagnose this condition, and we are able to take the radiograph. So here we are, here it is shown that the first radiograph, the herniated part, and after we operate these animals, we usually we operate and we open the thorax and we remove the herniated part, and we again close it, and the second radiograph is after the it has been operated. So this is what we are doing, because in human you need not to assist the patient. You just say the patient lie down or stand up, or raise your hands or put your leg here, or whatever you say, the patient will obey. But here we have to handle it, and we have to handle with the help of the assistants and with the help of the owner. So the exposure to the patient, as well as to the handler, as well as to the operators, they are multiple times. So besides the patient, the other persons are also exposed to the radiation. That is a aspect in veterinary radiology which is very of very much concern, because at times the even some of the animals, we cannot take them to the radiology or radiography room or X-ray room. We have to take at spot with our mobile radiology machine, X-ray machine. So you can see a buffalo, a dog, and a camel being radiographed here. Similarly, a camel, and even wild birds and wild animals, we are also using the radiology to diagnose various conditions in these also, because the type of patients is endless in our field. We are dealing with cat to camel, and with birds and with reptiles and all the animals except human we are dealing with. So these are some radiographs, and you can see a Sarah Hedwig, which is popularly known as Sanda. It is also somebody brings such a type of animals also for treatment, and we have to do that also. So in veterinary medicine, all the imaging techniques are used and described, but due to the organizational, managerial, and particularly the economical constraints, only radiography and ultrasonography are mostly used. And but there has been a boom in the veterinary diagnostic imaging after the arrival of CR system or digital radiography. Earlier, when the conventional methods were being used, some limitations were there. Then there came the ultrasonography, and we are using ultrasonography very frequently in small as well as in large animals, and we have been able to diagnose certain conditions with the help of ultrasonography. And I would like to inform here that the CT scan machine in India, in veterinary field, first ever CT scan machine has been installed at Veterinary College Bikaner in 2016, and since then we are using it, and after that only 2 or 3 institutes are there who has this facility of CT scan machine in veterinary field. Then the practice of medical discipline is almost unrecognizable with the modern radiology, and outcome of the treatment, any treatment, largely depends on the diagnosis, and the radiology is, as you know, the major part of this diagnostic protocol. Then the quality of diagnostic imaging equipment and the habit of using it in veterinary field has greatly improved in last decade. The as I told you, nowadays abroad and in India also, use of CT scan, use of MRI, nuclear medicine, is scintigraphy, etc., is increasing in veterinary field also, because as we felt that there are good reason as well as there is some matter of concern also. People are more and more becoming animal lovers, and we love animal lovers, but while they are shifting towards animals, some learned person told me that people have stopped loving each other, they have started loving animals. So this is good for animals and good for veterinarians, but not very much fair for the society. That is the off the track talk. Thank you. The modern imaging diagnosis, though very well established in medical, but still in infancy in veterinary practice because of the heavy initial investment and maintenance costs. Even a CT scan unit, if you want to establish a CT scan unit, it requires crores of rupees, and the funding is, as you know, is a big problem in every field, and particularly in veterinary field. Then lack of expert interpretation. When we started our CT scan imaging, the first concern was from where we get ourselves trained, because we are the first to install the CT scan. So from where we get an expertise or training. So, okay, sir. We contacted our counterpart medical persons, and I really thankful to Professor Satish Kachawa, the ex-principal and head of department of radiology at SPMC Bikaner, and he trained us how to take the image, how to interpret the image, and then after that we kept on practicing and we learned the. But one more thing, what in the veterinary field, one more constant is that we have to handle or we have to restrain our animals or patients, and sometimes we require anesthesia, because during CT scan particularly we cannot allow any person to stay in the gantry room because there is very high radiation. So we have to anesthetize our patients, and there are some conditions, very critically ill patients, we cannot even anesthetize every patient. Okay, then there is great variation in shape and size of animals. At times, if we want to scan a cat and a horse, there is very much variation. And even within the species, if you see a dog, a pug dog, you must be knowing a pug is a small breed and a Great Dane is a very big breed. So there is again very much difference. So that we have to keep in mind while scanning a animal. Then veterinary practice is more like pediatrics, because we always require a support.
Dr. Vishnoi, please conclude.
Thank you, sir. Okay, I'll try to. And the one more constraint is that we always require a table and to restrain the animal, and in all the modalities, whether it is X-ray or CT scan, the capacity of table is to be increased, and which is not till date, because the companies, they are making X-ray machine or CT scan machine. They are not making the X-ray and CT scan machine for use in animals. They are making for general use. So the capacity of table is a concern also. Now these are some challenges, as I told you. Even the owners, they are always not, we have to take consent of the owner, and all the owners, they are not giving their consent. They are, because they tally the cost of the treatment and cost of the diagnosis with the cost of the animals, which is not there in with the human practice. Their sentiments are more in human practice, but in veterinary practice, always there is a cost. So these are fluoroscopy we are using. This is the images of fluoroscopy. This is how we have to anesthetize the animals, anesthetizing a camel. This is the different terms are used in veterinary as compared to the human. This is cranial and caudal, dorsal and ventral, because the human is it is vertical with the ground, while the animal is always horizontal to the ground. So this is the CT scan machine, X-ray, gantry, and now, as far as the exposure to radiation, as I told, the handler, sometimes onlookers are also there with repeated requests. They still stay there and get themselves exposed. Although our assistant or a student is equipped with the lead apron, but everybody cannot be provided lead apron and the protection. So this is what I would like to emphasize. And this, as far as the scope of the radiology in veterinary field, it is enormous scope, because time is coming when we are going to use all the modalities, and with the radiation therapy, radiobiology, all have been started in some part of the world, and we are also planning for use of radiation biology, radiation therapy in our patients also. Thank you, sir.
Thank you. Hand over to Dr.
Thank you, Dr. Vishnoi, for an excellent presentation. In fact, you mentioned, humbly mentioned in the beginning that you are not doing as it is being done in the medical field, but we are number one, at least we are on the top in terms of the bovine population. And we particularly know that how the health of the animals is as important as that of the human, because we are completely dependent, our dietary, if we see the diets and all, the transfer of diseases that happen, we need to take care of the animal health as we are taking care of the human health. So also thank you for highlighting all the issues, in terms of the deficiencies in the machines and what the changes that are required, what are the problems that you have when you are going in for different animals. Humans are pretty easy probably because they are more controllable, and also highlighting that the handler also get exposed, and it is very, very difficult to request. You can request the handler, but very, very difficult to convince him to move out of the room, because they will be more connected with their animals. Also, I would like to urge Dr. Purohit, if he can, ensure some of the press publicity to Dr. Praveen's, discussion that we have had today. So how the issues that he has highlighted, how they can be brought to the notice of the people who matter, and also how we can draft some of the limitations and the challenges that he has mentioned, how we can put them in the proceedings or the final the recommendations that are going to emerge out of this ICRB 2022. Thank you, Dr. Praveen Bishnoi, for an excellent presentation. Over to Dr. M.D. Sharma, please.
Thank you, sir.
Thank you, Dr. Bhupender. Rest assured, the whole conference will be highlighted in the media of national and international level. Since I'm in charge of media of Dungar College, you don't worry about that. Thank you, Dr. Praveen Bishnoi. I know your busy schedule. You have accepted our invitation. But one thing I would like to mention, can we have some collaborative work? Many of our students, they are working in the field of radiation biology. They are working on mice and guinea pigs and other animals. And suppose you have the radiation facility, in what way, what kind of way you can help our scholars in our college?
Yes, as I mentioned in my talk earlier, that we had now the time that we need to work together. And on behalf of Rajavas, I always welcome the students who want to work in collaboration with Rajavas, and we can provide you diagnostic facilities in terms of CT scan for small animals, in terms of sonography, in terms of radiology, and all other facilities. Whatever they require, I definitely will be delighted to work with your esteemed institutes. And thank you, Dr. Bhupender, for your concern about the issues I raised. Thanks, sir.
Thank you, Mr. Noike. And I would like to mention here that in Dungar College we run the Bikaner Interdisciplinary Center for Research. So Dr. Narendra Bhojak is the convener of that particular program. So we can connect each other through that program also. Thank you very much.
Thank you, sir.
And keeping the constraints of time, now I request Dr. Sakar Kalecha to come up and present his research work and invite the students. He is assistant professor in Rajavas, and from 2020 to present, he is the principal investigator, Central for Studies on Wildlife Management and Health, Rajavas Bikaner, and he got the Vice Chancellor's Award for initiatives in quality education in 2021. I welcome Dr. Sakar Kalecha for his presentation.
Thank you, sir.
Dr. Sakar, before you start, I'll request Dr. Sakar, Dr. Bhojak, and Dr. Meera, the next three speakers, to kindly, I do understand we are all senior people, and but senior people also have a responsibility to convey our, whatever we want to convey in less time. So I'll just request Dr. Sakar to kindly skip the introduction and how balance it and finish it in 10 minutes, please. Thank you. We are already, half an hour short of time.
Definitely, sir. I will try to sum up this. First of all, I thanks the organizing committee of ICRB for inviting me as a speaker to speak on the clinical applications of small animal diagnostic imaging, in particularly in reference to computed tomography applications. With the permission of Chairman Dr. Bhupendra Singh ji, Co-Chairman Dr. M.D. Sharma, and Rapporteur Sumalata Tripathi ji, I am starting my presentation. So the technological advancement, it took place in veterinary imaging right from 1920s, when we started using the conventional radiography. And then with the due course of time and the technological advancement, we shifted to the digital radiography. And now in veterinary practice also, the digital radiography, it has altogether supplanted the conventional radiography. The reason being with the advancement in the electronics, that the X-ray film which was used in the conventional radiography, it has been replaced by the detectors, X-ray detectors. And two techniques which are currently used in veterinary and as well as in medical imaging. These are the indirect digital radiography and the direct digital radiography. Then with the advancement in veterinary medicine, because this radiography is a two-dimensional imaging, some of the lesions or the pathological conditions which are not able to be diagnosed in the two-dimensional imaging, then the science felt need the tomographic imaging. And with the development of this tomographic imaging, this computed tomography imaging, this earlier known as the computed axial tomography, it means it uses the computers as well as the X-ray source for imaging different body parts. Now, CT uses the principle of tomography, as it is also known as the sectional imaging. The importance of this type of cross-sectional imaging is that the neighboring body structures in a particular image, these cannot be influenced. So there will be no superimposition of the overlying structures. And this tomographic application, it has helped in getting the details of complex anatomical structures, which were not perceptible in the two-dimensional imaging because of the superimposition of the bones. Now, this is the CT machine that earlier Dr. Praveen Bishnoi sir has told about. This is a 16-slice CT scan machine, which is showing the gantry. Over there in the gantry, we have the X-ray source and the rows of detectors, which is mounted for imaging. And the basic principle of imaging is that the patient is laid on the table under general anesthesia, and the X-ray source and the detectors, they move in unison movement to create an image. The X-ray passes from the body of the animal, and the tissue in the body, it has the differential ability to attenuate these X-rays. And the attenuated X-rays, these are being captured by the detectors, and during the projection, the information in a form of electronic signals, it is transferred to the computer, and using the mathematical algorithms, the digital image is created in a form of slice, which we call as image slice. This is the position of the animal. Our CT scan machine has the capacity to hold the animal of 130 up to 130 kg body weight. The animal is placed under general anesthesia, either in a head first position or the tail first position, or it will be placed in a either sternal recumbency or in a supine position or in lateral position. These help to identify the normal anatomic orientation of the animal while we are interpreting the anatomical structures or the pathological lesions. Initially, during the scan, the transverse images, they are captured, and these transverse images are in the axial plane. They undergo multiplanar reconstruction or reformatting, and we can create the images either in the sagittal, coronal, oblique planes, or by using these slices of images, we can create a three-dimensional image of a body. In this figure, you can see the skull of the dog, which is reformatted or reconstructed by using a different series of contiguous images of the head region in the dog. Now, in the previous lecture, linear attenuation coefficient was described that denotes the differential capacity of the organ or the tissue, that it can attenuate the X-rays. And based on this attenuation, the Hounsfield, it gives the number to different tissues based on the differential attenuation capability, and different organs are having a different Hounsfield units, or which are now being called as the CT numbers. The water and the air. Water has been assigned the CT number 0, and the air, it is more negative, around -1000. So this CT number act as the reference values, and based on these CT numbers, sometimes if a pathological part or organ which is not clearly identified, or if the anatomical details are lost, by use of knowing the CT values or the Hounsfield units, we can identify whether it is a clotted blood or it is a normal CSF or some tumorous or soft tissue structure. All have the attenuation capacity and the density. The computed tomography, it has created a great revolution in veterinary medicine and is most valuable in imaging workup in small animals, particularly dogs and cats. However, in developed countries, CT is also being done in large animal, particularly the precious equine species. And this clinical application of CT in small animal, it is most valuable in imaging or examining the bony compartments, particularly the skulls. Otherwise, there is the only method to see the pathology in a skull is just you open during surgery and you identify the pathology. But with the help of this technique, we are able to find various pathology involving the axial appendicular skeleton, thoracic structures. Although for abdomen, USG and MRI is useful, but CT also plays important role if you have more advanced facility than the ultrasound. And CT, it is considered as a gold standard technique for detecting the metastasis in case of tumors, particularly in the thorax. So the advantage of CT imaging is that it has superior soft tissue differentiation because of differential ability of tissues to attenuate X-rays. There is no superimposition of the anatomical structures. Digital CT images are on the digital format so that they can be sent to anywhere in the world for second opinion and consideration. And the grayscale. Grayscale is adjusted. CT, it has the capacity to adjust, having almost approximately around 4,000 shades of gray. And this wide exposure latitude or the range of gray shades, it helps in identifying the tissues which are having the nearly equal density. So the better distinction of tissue density and the ability to detect subtle changes in the organ, it has made this technology very useful for identifying various pathologies. So in these images, you will find the pathologies like this is the fracture of the mandible.
Dr. Palicha, maybe you can conclude.
Sir, it will take only five minutes. Sir.
ज़्यादा हो गया.
2 minutes, sir.
I will keep moving slides, sir.
क्योंकि मैं दूर बैठा हूं पर रिक्वेस्ट कर सकता हूं आपसे बस.
Sir, thank you, sir. So these are some fractures which can be diagnosed using the CT images. This is the case of secondary hyperparathyroidism, in which the osteoclastic activity it has occurred and the fibrous tissue has replaced the osseous tissue. So these are again osteolytic lesions. This is a hydrocephalus condition in which you will find the CSF in abnormally distended ventricles of the brain. This is congenital spinal bifida condition. So these are also helpful in diagnosing the various vertebral pathologies, like you can see the fractures which cannot be detected on the X-rays using the two-dimensional imaging. This is again fracture of wing of Atlas. This is the multiple myeloma condition. You can see the bony osteolytic lesions in the lumbar vertebra and the sacrum. This is ossification of the dura mater, and it leads to the development of intervertebral disc disease and spondylosis deformans, in which there is bridging between the vertebrae. In this case, we did the CT myelography to detect the spinal cord trauma and the fracture of vertebra. This is the necrosis and degeneration of femoral head in leg of Perthes disease. They are degenerative joint disorders, fractures, the microfractures of fourth metacarpal bone, the pelvic fractures. These are some neoplastic disease which can be identified with the help of CT, and we can create the three-dimensional image to see the extent of the pathology, and accordingly we can plan for surgical procedure. So this is again fracture, osteosarcoma. These neoplastic conditions are confirmed on the basis of histopathological examination. These are periosteal reactions. This is again osteosarcoma of tibia and fibula bone in a dog. This is sinonasal tumor. You can see the soft tissue attenuating density. This is neoplastic condition of T2 vertebra. These all have been diagnosed at our veterinary clinical complex on this machine. These are metabolic disturbances leading to hyperostosis or osteopathic lesions. Thoracic disorders, you can see the multiple. This is due to penetration of the pointed bone lodged in the esophagus, and it has ruptured the pleura, causing the pneumothorax condition. These are pleural masses and pleural effusion. You can see these cannot be diagnosed on the radiograph. Radiograph has the capability to diagnose 7 to 8 centimeter lesions. So abdominal lesions, you can see the hepatic mass, microhepatia condition, degeneration of liver, spleen.
Dr. Sakar, please.
Just I am coming. Just I will show you this slide. Around 20 fishes were brought from the Kamdenu University just to see the bony arrangement of in the species, fish species they have carried. So we did the CT scan of those fishes, and they have used some data for their research and study purpose. CT has its application in forensic imaging. This is also interesting. I will take only 1 minute. One falcon was captured from the border security force and fitted with some transmitters. They suspected some chip lodged inside. So with the help of this imaging technique, we identified the chip and we take out this chip surgically. So these our purpose is, although the exposure radiation during diagnostic imaging is very less, but we try to keep the radiation dose as low as reasonably achievable, that we call as LRA principle. And to achieve this, CT scans must be appropriately justified, and it should be done where there is a need. And all the technical aspects of each CT examination, it must be optimized. So some CT dose index value and dose length product, these are the parameters which are denoting the performance of the scanner machine and the dose which is to be absorbed, which is being absorbed by the animals. These are some data, but I will not go into detail. The only one thing is that the CT dose index, volume CT dose index, it is fixed and independent of patient size and the scan length. Only it has limitation that it cannot tell about anything about the length of the scan. So the risk of biological risk, we can assess whether the animal is having the great biological risk by knowing the dose length parameter, in which at the same volume CT dose index, if the scan length is more, there will be more exposure radiation to the animal, keeping the MAS and the kVp same. For CT, we are keeping the kV same, around 120 kilovolt, but milliampere second, these are automatically adjusted with the help of software which has come along with the machine. So in conclusion, the rapid image acquisition, increased resolution and multiplanar reconstruction in CT imaging, it aids in characterizing the pathological lesions, surgical planning and management of various surgical conditions in dogs, and as well as in all animal species. The manipulation of some CT parameters, they produce diagnostic imaging at lower doses, which is very critical for safe imaging. Thank you. This was all about the brief overview of CT application in small animal imaging.
Dr. Sakar, thank you very much for your presentation. I think we don't have any time for question answers, but an excellent overview of how the CT applications are being done in small animal imaging, and also how you are helping the intelligence agencies also, and also other researchers. Thank you very much. I had a few queries, but I would request anyone who is having question to meet Dr. Sakar separately. Again, I will urge, I think I'll invite Dr. N. Bhojak, and he'll be talking about green biotechnology, green chemical biotechnology. Again, I will urge Dr. Bhojak to kindly stick to the time of 10 minutes. I see the issue for Dr. Purohit, who has another session in hand and has to prepare for the valedictory at 1. So I'll now request Dr. Bhojak kindly start and finish it in 10 minutes. Dr. M.D. Sharma ji, please give no more than 10 minutes, please.
Right, sir. And I invite Dr. Narendra Bhojak, Associate Professor in Chemistry in Government Women College. He is going to join us online. I invite Dr. Professor Bhojak. I would like to tell you that he is a torch bearer in green chemistry as far as Government Women College is concerned. Dr. Bhupendra Singh ji. Dr. Narendra Bhojak.
Dr. Bhojak, we are ready for your presentation. Please start.
You have to finish it in 10 minutes, sir. You have been allocated only 10 minutes for your lecture, Dr. Bhojak.
Dr. Bhojak, you are muted. Kindly unmute yourself. And you can start your screen also, the video also.
Is my voice coming?
Yes, yes, please start. Please start.
Okay. Okay. I hope that voice is coming. And I'm sharing my PPT. Are PPT visible?
Yes, please, you can start.
Okay, sir. Thank you. I will try to stick with time, Professor Bhupender ji and Professor M.D. Sharma sir, Professor Suman madam. Before I actually start this green chemical biotechnology topic, I would like to convey my best wishes and regard to Dr. R.K. Purohit and ISRB team to provide me this opportunity. I'm leaving most of the things and I'm directly coming to the background and preamble. Business is not for money, is for solving problem. This is a statement given by the Nobel laureate, Muhammad Yunus. And on this basis, we are trying to convert the green chemistry into the green chemical biotechnology for the sustainable development. This is one of the educated definition, but later on, I would definitely like to give you another definition. There are few thoughts about the development on which air, water, food, and energy. We are mainly working on the food and drug research, which is the, related with this particular conference. If I come to the top 10 areas, then these are the related with the biochemical sciences and other things. But I would like to emphasize only these 2 points where our group is working, or we are trying to emphasize on the targeted protein degradation part. As I said that these are the top 10 areas, but interestingly, this is the 11th one. What is that 11th? And I assure you, Dr. Bhupender, that by end of this slide, most of the part of my presentation will be finished. This is the biosensitization. And this technique we have developed during the last 25 years of the course. And this is biosensitization is a reverse technology. I started work on this in 1996, and recently we have got the advanced results related with this. And I'm happy to tell you that this is the 4th patent filed by us. Before that, I would like to tell you that this was the first patent. This is the 3rd one in the pipeline. And the 2nd one was based on the herbal formulation with the purity concept. So for the student point of view, for the audience point of view, my work is over. My job related with this conference is over, because biosensitization, if I'm going to explain, it will take more than 1 hour. So I cannot explain in the course of 3 minutes or 4 minutes. So how this journey began, and for the student point of view, I am taking few of my slides. Whenever you will interrupt me, I will stop it, because the most of the part is already completed by this slide. So for student point of view, I am asking few questions from the biology student, that you all are using LR grade acid in your laboratories, and you are stating or throwing in your sinks. How much water is required for neutralization of this 1 milliliter of strong acid or strong alkali, rather should I say strong acid, when you are throwing in the sink? How much water is required? You can write your answer in the chat box or in the YouTube chat box. I will try to answer later on. And the important second question is that which of the following is the most hazardous? All these are the significantly hazardous, but which is the most hazardous? Here I would like to answer for this question is that is around 20,000 liters. You answer can check there, 20,000 liters. And here I can answer that this is the cigarette. The plastic is considered one of the most dramatic part, but the cigarette is already containing the plastic. And this plastic is the part of the cigarette, particularly the greater, the better the quality of cigarette is claimed, and greater is the hazards there. Another question which is related with the radiation biology is that which of the following is the most polluted? Picture here. If you are from the radiation science, then I am not aware you are knowing or not that how this nitric oxide is being formed. Different kinds of NOx are being dispersed here in normal conditions, that we are having combination of reaction of end-to-end oxygen around at 1200 degrees Celsius. But when we are having the radiations, particularly in the chambers of chimneys, etc., then we are decreasing the temperature, lowering the temperature around 800 degrees Celsius. So your kitchen becomes the most hazardous part when we are taking. Now I'm coming to the part of green chemistry definition which we are providing. See that basically when we are talking about the green chemistry and green chemical biotechnology, we are not raising any such problem for which we are not having the potential solution. If we are having a potential solution, then it is the green chemical technology, green chemistry and green chemical biotechnology. So in the next 5 minutes or so, I would like to tell you some of the processes which our laboratory have developed and how we have developed it. This is the spironolactone drug, potassium sparing diuretic water pill. It is used for the acute heart patients. I'm just like to give you the idea that it is required a dose of 100 milligram per day, but only one particle of this is sufficient. I repeat, one particle of this is sufficient to stop the chain reaction of cytochrome P450 and cytochrome C, which is the potential binding site for that particular acuteness. But at the same time, when you are providing the 100 milligram, how much you are giving? You are giving the 6.02 to 10 power 23 in the range of 6.02 to 10 power 19. But when only particle is effective, then what is the effect of other 6.02 into 10 power 18 particles? Yesterday, a few scientists were talking about the toxicity, but I'm sorry that when we are talking about the toxicity, we are not discussing about the side effect of the other particles. 6.02 into 10 to the power 18 particles are creating the toxicity. So we thought to work on this particular spironolactone in two different ways. First is to restore this structural aspect by using the microwave assisted synthesis, converting it to the one step or two step. At the same time, I will have to skip this because I cannot explain it. But I can explain you this formulation. This formulation we are calling the green formulation because we have decreased the 100 milligram per dose per day dose into 1 milligram by using the technique of micronization. And I'm happy to tell you that in 2017 we could not only able to develop that particular technique of micronization formulation in our laboratory, but we have also supplied to the 3 countries who were facing with the Ebola at the time, South Africa and Australia to this, and these particularly designed tablets. And you can find that these 3 are the researchers from GCRC. Dr. S.K. Verma is managing all the things here, Dr. K.K. Verma, Dr. Umar Rathod, and Dr. Harish is there. So this is for the student. At the same time, I would like to tell you to students that when we are talking about the plastic, there is the need of plastic, hazards of plastics. When you are talking about the social science, the biodegradability is not the important aspect. The garbage management is important. But for the biologists, biodegradability is the more important part. But for the chemist point of view, the basic problem is not above 2, which I mentioned. The basic problem is the bisphenol A. Bisphenol A is found in almost all kinds of the plastics, and hazards of bisphenol A, all biologists are knowing. I'm talking about the DNA methylation and neuroblastoma. But the interesting point is that when you are taking the bisphenol A at elevated temperature, for example, you are providing this to your kids at the elevated temperature in the tiffin boxes for the hot cases or to the milk bottles, then this bisphenol A above 52 degrees Celsius is coming out in the milk or in the water or in the tiffin boxes. So it's creating the more hazards. But at the same time, now you must have seen that there are BPA-free plastics also. The story of the BPA-free plastic is also very important and interesting. All of you are taking tea in the luxury shining cups, and all these cups are containing either dioxin or styrene. So these are also creating the cancer or the side effects. But at the same time, due to the radiation, these effects are increased. And then more important part is the commonly used solvents in the industry, particularly the chip industry. I'm emphasizing here methanol, acetone, absolute ethyl alcohol, ethyl acetate, all these are important. So when we are going for the herbal formulation, normal extraction is required either by at sock slit extraction, sonication, microwave assisted, or ordinary at room temperature. This is the only slide I would like to emphasize, sir, particularly for the student point of view. So far, I have emphasized about the problems. What are the problems when we are thinking like the green chemists? The basic problem was the related with the garbage management when we were talking about the plastic. For the biologist point of view, it was the biodegradability, but for the chemist point of view, it was the BPA-like chemicals. But the important is that when the industries are claiming they are not using the toxic chlorinated solvents and they are using only the acetone or alcohol type solvents, but at the same time, when there is loss of particular amount of, is there any problem? Someone is talking, so I request. So when there is a solvent loss, is going in the atmosphere. Alcohol and acetone is also going in the atmosphere after clouding. When it's going down in the PWD waterwork supply center, that particular acetone is also there. Here, actual chemistry starts. You know that chlorine is passed here. What's the purpose of chlorine? Chlorine is using as the disinfectant, but that disinfectant is creating the major problem. The industry which were claiming that alcohol or acetone is there, we are not using chlorinated solvent. You must be knowing famous haloform reaction in the 12th class chemistry, that chlorine is reacting with the traces of that acetone or alcohol, that creating the dichloroacetone, monochloroacetone, trichloroacetone, finally into the chloroform. So what you are providing due to the industrial pollution, not only the unclean water, but you are providing the chloroform. And I tell you very sincerely that no RO can not only the purify, but it even cannot trace the traces of chloroform in that water, and is being supplied industrial areas of PWD centers. This is one of the biggest region where we should started to work. And as I mentioned earlier, these are 3 points. So for the green chemist point of view, the induced or delayed toxicity with respect to the purity is the most important part. So as a green chemist person, I'm not working on the above 3 aspects. I'm only working on the despite of the fact I should have the knowledge of above these 3 things, but I'm not having. Even then we are starting. These are our collaborators from the BARC, and you can find the Calotropis procera and 12 other species on which we started to working. And we developed the technique of the green extraction, on which we developed the nanoscale extraction. If Dr. Madhubala is listening me, then I would like to tell you, ma'am, yesterday you were talking about the accredited laboratory concern. So we are already having one sophisticated instrumentation lab here, and another is the smart science lab, where we are developing these techniques, and we are in the process of accreditation. But definitely we are in the process of ISI accreditation, and from your inspiration and words, we would like to take it into the NABL aspect also. So within 1 minute, I would like to tell you what is the role of surfactant. The people are knowing that oil and water are not mixing. If you add oil in water and water in oil, it will not mix. But if we add the surfactant, we can mix it. And it is the beginning of the green extraction technology using the micellization or the microionization. So there is the formation of micelles, and this is creating the hydrophobic head and hydrophilic tail. The important point which I'm spreading for the student is that now we are having a technique where we can mix oil and water or any hydrophobic portion into the water, or vice versa. Is very important. And this technique you can learn in your courses. So we developed that technique and applied on Calotropis procera, that is known as ARC or ACRA, with respect to the 30 micellar systems. We developed the rod shape. And I'll be skipping it because biological micelles we used. Interesting part is that for the micellization technique, the beauty of this is that it's not only the increasing the solubility and the stability of the system, it is also increasing the absorbance power of it. And due to this absorbance, marked increase in absorbance intensity, we would able to develop the technique of analysis as well as the purity preparation. So I developed, our group developed isoflavonoid extraction, as I told you earlier, that was in the 1994, and thereafter isoflavonoid and flavonoid related, we could able to develop the 30 extractive parts for the 30 biomaterials. And finally, I would like to emphasize, this is the nano shape particles which we could able to develop by the same micellization technique. Yesterday, again, someone talking about the gold particles. If you use the micellization technique, you will not only able to develop the gold nanoparticles in the particular specified range, but at the same time, there will be the marked decrease in the toxicity, and that will increase the purity of the system. And that is very important. And that is related with my first slide with the 4th patent, that is the biosensitization part. So this is the slide you can find. I'm showing here with the extraction part. So this is the development of nanoparticle, and we could able to develop the green particles of 32%. The biodegradability of that green plastic is 32%, and this is with the collaboration of Physics Department of Government Hogar College, Bikaner. So here this answer I have given. And ma'am, Dr. Madhubala ma'am, if you are here, and Dr. Bhupender Singh ji, I would like to tell you that this is the laboratory wastewater neutralization plant which we have developed in our institution. Now in both of the our post-graduation laboratory of chemistry department, we are not supplying this particular hazardous water in the system, but we are preparing the distilled water from this wastewater, and that technique has been installed. If you try to visit, if you get a chance to visit Dungar College, kindly visit it. And this is the interior designing of the 3-dimensional technique that has been developed by the Abdul Shahid, who is also sitting here and using this online technique. And this is Dr. Seema Vyas, and she has developed the croton bombodium plants extraction. This is for the mosquito repellent, and this become very important during the corona period. Sir, I would like to tell you that this was very important part in March 2020, when the corona was there. We could not only able to use the technology developed in that paper in 2016 for the preparation of green sanitizers, and we have not only supplied these sanitizer to the poor people at that time, but we have also shown this technique to our NAC peer visit team, and we have given the original samples of green sanitizer provided to them. And you will be happy to know that in 2021 in March, when we got the third time consecutively A grade, they have appreciated a lot about this green sanitization technique. And this is also the waste from wealth technique. Again, it is in the collaboration with the physics, chemistry, geology, botany. This is another aspect of smart science laboratory. I will skip it because this is completely different. And you can find that we have developed the physics, chemistry experiment, geology, botany experiments. Honorable Education Minister Dr. V.D. Kalla ji and Dr. Shri Bhavar Singh ji also observing it and doing the experiments. All these material is available on these website. I will share in the chat box, and I can share the part with that. And this is very important, and this is directly related to the radiation as well as biology content that we are using this for the three-dimensional printer. This is the polylactic acid, and recently we are in the process of filing another patent where we have replaced this polylactic acid, whose cost is 36,000 per kg, to around less than 50%. This is just 1 minute I'll take. Green audit part, Dr. H.S. Bhandari, who is my colleague, and we are working it. This is another aspect which we have recently developed and extending our aspect to other nearby colleges, institution. Recently, we have done the green auditing of one of the university from this college. This is one paper book published, and he's the James Clark, editor of Green Chemistry. Impact factor is 11, and John C. Werner, we could able to publish one very good book with them. This is one of our collaborator. We have developed the extraction technique of the curcumin, and finally, I think within the course of time, if I can finish it, this is Interdisciplinary Research Consortium, which we have developed here in our institution. And I would like to convey my best regards and thanks to Professor B.S. Kirk and A.C. Jenser. A.C. Jenser is no more now. In the second corona wave, he died. But Professor S.K. Sharma, S.K. Bishnoi, and B.C. Das Neelam Sharma is providing a lot of collaboration to this, and to all of my research scholars, and particularly the funding agency which have provided us the big project, due to which we could able to develop this green microwave biochemical reactor, and could able to find the could able to get the second patent of this. These are the few research papers which we have published, but I would like to mention here, if you are interested really with related to the development of the science, you should read this particular review article, which is in a big collaboration. Professor Bhupender ji must be knowing Surendra Kumar Mehta sir. He was the professor at Chandigarh University. Now he has become the vice chancellor of Ladakh University, Ladakh Central University. And recently in 2021, we have published this paper. And we have also worked on the augmented and virtual reality with these application. I think due to the limitation of time, I could not able to justify with the topic, but because it's our institutional conference, so I will have to stick with the time. And sir, interestingly, I would also like to tell you that I'm just 100 meters away from the main auditorium, but it was important to for me to manage the online system, so I'm giving it online. So thank you very much.
Thank you, Dr. Narendra Bojek ji. First of all, my apologies for limiting your restricting your time of presentation.
No, sir, it's not of your side. It's from we are from the organizer side. So I was interested.
Yes, but such an interesting talk, and congratulations to you and your team. for the patents and for the good work that you are doing, be it in terms of removing the pollutants from the water, or be it in terms of developing methods for isoflavonoid or flavonoid extraction, or be it for developing, the anti-malaria or the mosquito repellent. I should say there are a lot of good work that you are doing in terms of the green biochemistry. A lot of lessons for everyone to learn, and I would urge sometimes we need to explore and exploit these platforms for also knowing what each of us is doing and in which area the collaborations can be developed. So I will urge all the people who are connected through virtual mode or sitting in the auditorium there to kindly, think of the collaborations that you can develop with Dr. Narendra Bojak, who has such an excellent facilities at their end. Thank you, Dr. Bojak, again for an excellent presentation. Over to Dr. MD Sharma ji for inviting the last speaker, Dr. Meera Srivastava, please. Thank you.
Thank you, sir. And thank you, Dr. Bojak, for the informative talk. Now, I invite Dr. Meera Srivastava, madam, the former Principal Government College, Loon and Head Department of Zoology, Dumar College. She has supervised 24 scholars for their MPhil degree and 17 for their PhD degree. She has been the convener board of studies in zoology in MGSU Bikaner, and so many awards, and she has visited several countries too. Due to lack of time, I'm not introducing the complete biodata.
मैडम 10 मिनट में खत्म करना आपने, आपका प्रोग्राम है.
Yeah, sure.
Please.
Good morning, everyone. The chairpersons of the conference, Dr. Bhupendra Singh ji, Dr. M.D. Sharma, Repertoire, Dr. Sumanlata Tripathi, Dr. Madhubala and Dr. Kalia, who are on the line, and I've been seeing them throughout the conference. First and foremost, I wish to thank the organizers for giving me this opportunity. And here I would like to say that had it been in the year 2020, I would have been part of that organization committee. But anyhow, Allah has superannuated. And further at this juncture, I would like to mention that I'm not a radiation biologist. I'm not associated with radiation at all. But yes, definitely I'm concerned with the mankind, the humanity. And I would take you to another world. Since last 2.5 days, I must say, the conference has been dealing with the human, the animal life, animals associated with animal husbandry, wildlife, the higher mammals. But yes, there is another little creature which is of great importance and great significance. First, I would just like, and I know that I'm the last speaker, the whole burden of this time schedule lies on my shoulder. I have to complete within the stipulated time, and I will just rush. I would not take your time, but because of the concern, I want you all to be concerned towards this, because it is a major, significant, important aspect of the radiations. So see, the title of my presentation is Electromagnetic Radiations, an Emerging Cause for Insect Decline. There's a big question mark. Yes, still it is a question mark, but yes, we need to know whether it is so or not, and the problem I'm posing in front of you. The significance of insects, as far as we all know, they have a very good, a very important role to play in the ecosystem. They have various different roles, and the number of species, if you all see through this diagram, 50% of the animal and the plant life in these are the insects. So the left half of this slide, 50% shows the distribution and diversity of insects. So this is the number of insects on the globe. That means if they are that much in number, definitely their role has to be important as well. They are useful. These are some usefulness which I have tried to highlight here, but then their role is much more than this. They act as pollinators. Now, the pollination, about 80% of our crops, and we all know that we are dependent upon agriculture. So, pollination, decomposition, the carcasses of all the animals here, they are first eaten up by the insects. That's the first line, and then it goes on to the microorganisms. So there's a great role they play as a decomposition, soil enrichment, being consumed as food. Yes, controlling other insects as pests. I'll just show you a few of the insects, how they're useful. Research and experimental method, bioindicators, warfare as biological weapons. They have been used in the World War, forensic sciences, and of course, biomimicry, which is a modern technology. So just see the honeybees, you all know honeybees, and the butterflies, these are the pollinators. This is a decomposer beetle. You all know, you must have seen them. This is a mealy bug, which is of a very delicacy, especially in other countries like Germany. This is Rhodolia cardinalis, a classical example of insect, controlling insect. This is Drosophila. Most of the zoologists, they know that most of the researches have been carried out on this little insect, and then further on other animals of higher grade. These are bioindicators. They show the water quality, very important. If we see the presence or absence of this insect, we can adjust the water quality. Now, this is one Colorado beetle, which was used in the World War as a weapon. The flesh fly, which is decomposing the flesh. And of course, their role now in the latest technology, which is biomimicry. Just example, I'll just show you. Now, these are the insect eyes, which have been inspired the structure of new solar panel cell. So the scientists of USA, they have used this, and yes, the new and upcoming scientists, the budding scientists can look into this. They can surf in the net and get to the details of this biomimicry. This is another example of the termites, how they make their termitorium, their nest, the place of stay, and how they keep them cool. So this design of the nest is being taken up by the scientists, and they're working upon in making the system or the workplaces AC. They are productive. Of course, we know that they produce honey, silk, lac, so on, and they're used in various other purposes of oils, medicines, and some decorative items as well. Now, this is the honeybee. This is the silkworm. This is the lac insect, very common here in Rajasthan, the lac industry. So we have around 1 million insects that have already been described, but unfortunately, there are another 4.5 to 7 million that have not been identified or named. So that means, see the number which is still to be explored. But what the situation is that we have lost up to 40% of our insect population. As of 2017, the latest information is yet not available. We have lost at least 66 insect species within the last 500 years. And as of July 27, the IUCN, it says that 343 are endangered and 21 species as endangered as well. Now, just a glimpse. This, we have lost this, we have lost this, we have lost this, we have lost this. See, these are the pollinators. We have lost this. These are the butterflies, beetle, the butterfly. These are the endangered species. Now see, this was such a beautiful Queen Alexandra birdwing, largest butterfly, but we have lost it. Just a glimpse. So, see the significance. We are losing insects, and now I would like to just emphasize in short the impact of electromagnetic radiations as per the available reports, because I've already commented, I'm not a radiation biologist, it's not my work, but only based on the reports available, I'm citing this. They have been reported to be sensitive to electromagnetic radiations on reproductive success. They have negative effects on reproductive success, development, navigation. Now, these workers have suggested that the radio frequency signals produced by mobile phones increase the number of offspring, cause other effects on reproduction, development of the fruit fly. These are the experimental insects which have been affected by the electromagnetic radiations. Some other studies showed that the reproductive capacity of fruit flies decreased by 50 to 60% after exposure to the radio frequency signal of a mobile phone during the first 2 to 5 days of adult life. So these are the results on the reproductive sexes. There are some reports on the immune system physiology of insects. These are on the behavior and navigation. This is very important. The workers have demonstrated how changes of low intensity in the normal local magnetic field values affect the behavior of magnetosensitive workers of ants, inducing significant changes in their foraging activities. You all know that they move from places to places and they forage for their food, for other activities, and come back to their nest later on. Experiments have demonstrated that the effect of 900 megahertz electromagnetic waves of ant olfactory and visual learning, revealing an impact on their physiology. So there are not many behavior. According to a report in the Beekeepers Journal, after the installation of mobile phone equipment, nearby 37.5% of bee population were more aggressive. 25% of the bees tended to leave the hive, and 62.5% reported to collapse of the bee population. They have a significant role to play in pollination. That is the agriculture we depend upon. And if this is the state of decline of insects because of the electromagnetic radiations, see how it is going to affect the mankind. So there are a lot of studies. I won't go now. I just want to emphasize on this. This is a German study recently carried out by the Germans, and the report comes in the Nature and Biodiversity Conservation Union. They have said, this is by Johnson and Slay, who is the head of the department of NABU. They have worked along with the NGOs and said that the radiation from mobile devices and the Wi-Fi fields have played a contributory role in the recent dramatic decline in insect populations in Europe. The studies and analysis of 190 papers, the researchers deemed 83 of these studies scientifically relevant, and 72 of these studies correlated that electromagnetic radiation has a negative impact on bees, wasps, and flies. So it reduces the navigational ability, and how it works, it's that they absorb more calcium. This in turn triggers a biochemical chain reaction, disrupting their circadian rhythm and immune system functions. This is how the radiations work as far as the biological aspect is concerned. Now, Dr. Klaus Buchner explains in a very simple term that bees and other insects whose bodies contain iron are disoriented by 5G waves. This is a very recent report because they interfere with the Earth's magnetic field that helps bees to know where they are going. And if that is the disruption, they are not able to go back to their hives. And if they're not able to go back to their home, definitely we are losing those insects. And bees, again, I would emphasize, are very important. So a recent study has warned that in future, more short wavelengths of electromagnetic fields used for the wireless telecommunication systems, that is the 5G system, which is we are expecting, will become comparable to the body size of insects, and therefore the absorption of RF EMF in this group of insects is expected to increase. Yes, so the biodiversity of insects is threatened worldwide. Loss of insect diversity and abundance is expected to provoke cascading effects on food webs and ecosystem services. Most of the workers suggest that the insect abundance, the decline is attributed to the agricultural practices and of course the pesticide use. But the examples which I have just quoted, on the other hand, as per these reports, the evidence for the effects of electromagnetic radiation on insects is being suggested. Evidently,
Madam, please conclude.
Just 2 minutes more, sir. It's not even 2 minutes. That the electromagnetic radiation, I understand because of the last speaker, I have to rush. They should be considered seriously as a complementary and emerging cause for the dramatic decline in insects. Undoubtedly, the data is insufficient to reach to the conclusive decision, and therefore it is imperative that more work be done on this aspect. Radiation biologists or altogether the radiation scientists have a lot to do in future. Workers not only should focus on the human and wildlife or the animals that we are doing today, that I've been listening to since last 2 days, are concerned towards the human, towards the other animals. But yes, we also need to recognize the importance of this little creature, that is insect. So I think I've answered to the question why these insects need to be considered very sincerely now. In the end, that the number is declining. The last line is very important. If we lose insects, then everything is going to collapse. Minded, these are not my words. These are from the Dave Golson, who's working on the insects, and they are really concerned about this decline in insects. So we also need, as a radiation biologist, I'm putting forth this problem for you to solve, the radiation biologists, that can we do something for them. Thank you.
Thank you, Dr. Meera, for an excellent presentation and for highlighting the importance of insects and also how the electromagnetic radiation that is emerging from these mobile towers and others, how they are affecting. As you rightly said, that we ourselves are, at loggerheads with each other, and there are contrasting reports available in the literature vis-a-vis the effect, whether it is caused by agriculture or whether it is the towers, because, and also we know that if we don't have connectivity on our phone, we will request the authorities to install a, the tower near our place. Maybe in your campus itself, you will be, we had this issue in our campus also. And despite my resentment, there were many which were installed. Probably we, happen to learn things after the milk is spilled. This is another problem with us. And thank you again, Dr. Meera, for highlighting the issue. And before I hand over it to Dr. MD Sharma ji, I'll request Dr. Purohit to kindly serve the tea in the hall itself, so that we don't have to break for the tea, and he will be ready to finish it in time. Thank you, Dr. Meera. And so I thank all my, presenters of this session, starting with Dr. Anami Bhargava ji, our Praveen Bishnoi ji, Dr. Saka Kalicha ji, Dr. Narendra Bhojak ji, and the last speaker, Dr. Meera. Over to Dr. MD Sharma ji.
Thank you, sir. I invite Dr. Broji. Next one.
Thank you, Dr. Meera ma'am, for a nice lecture. As I spoke at 10 a.m., we have to start validity function at 1 p.m. Honorable Minister, Elder Brother of Dr. Anila, MP Jodhpur, Member of Parliament, the Shakti Mantri, Shri Gradation Shekhawat, he will be joining at 1 p.m. Thereafter, at 1:15, Honorable Vice Chancellor, deemed to be University, Native University, Mangalore, Karnataka, he will also be joining at 1:15. The scientists from United States, from Germany, Australia, they all are online. So without taking so much time, first of all, I would invite Dr. Anami Bhargav on the dais. I would request the chairperson of the today's session, Dr. MD Sharma, and my very good friend of mine, Mr. Bhupender ji, really we missed you. I thank you so much for sparing your valuable time. Dr. Anami, please come to the dais. And today I would invite my students. They have been attending all the sessions since last 2 days, last 3 days. First 2 rows, you please come on the dais. You will present the memento and booklet to your teachers. जोर से ताली बजा के स्वागत करोगे सबका, है ना? Very good, nice. Only 2 rows, first 2 rows. Doctor, can you have the coordinates, man? Yeah. The professor of geology from, I think, Binani College, and the department, Dr. Deepthi Ranga. May I humbly request to come to the dais, Dr. Deepthi Ranga? All students come from there, come. Please come. All students come. Only for company. Please come. So part other please. Pinter. Some of the students please. Also. I would like to introduce Deepthi Ranga, seated PhD under my supervision. She is professor head the Binani Kanya Mahavidyalaya of Bikaner, and I would like to mention she is the recipient of first position, first award of the Nestle Essay Competition we organized in the year 2010. So I will request Dipti Ranga and Dr. M. Sharma sir to present memento and the certificate to our first invited speaker, Dr. Nami Bhargav. Yeah. Dr. Smriti Patel. Thank you so much, Dr. Nami Bhargav, for very nice lecture and spending valuable time for you all. Next, I would invite a very good friend of mine, is Professor Head, Rajuvas, Dr. Praveen Bishnoi. Please come to the dais, Dr. Praveen Bishnoi. And Dr. M. Sharma, he will present the book and memento. All the students, you all also. जोर से तालियां बजनी चाहिए. Thank you so much, Dr. Praveen Bishnoi. Very nice lecture.
Thanks to the organizers. I would like to thank the organizers and all Google College for inviting us and be a part of this conference. And I would like to come again and again. And definitely, I would like to work with the faculty and the students of this college. Thank you, sir.
Thank you. Now, thank you, Sis. I would request roll number second and third. Here all, we have to follow the social distancing also. So I am calling one by one. Please, students, you all come fast. I would request Dr. Shakar Palicha. He is the son of Dunger College. His father is served Professor K. Palicha more than 3 decades. He served Dunger College. Dr. K. Palicha was the student of my father-in-law and his father, Professor B.M. Professor. Then K. Palicha sir, I taught Sakar. The 4th generation of Sakar, Dr. Sakar Kamudi. Okay. I am very happy to see the young chair from Basic College, from Dungar College, from various other colleges. Dr. May I request Dr. Dipti Srivastava to join us? The convener of the industry conference, Dr. Dipti Srivastava. Yes, ma'am.
I request Dr.
Yeah, yes, sir. Yeah, okay, sir.
Kindly invite Dr. H.S. Bhandari instead of me, because I'll not able to leave from here. And he was the co-author in the same paper.
Sure, sir. Sure. Yeah. Dr. Hemant Bhandari, you please. On behalf of the Dr. Narendra Bhoja, Dr. Dipti, you.
No, Dr. H.S. Bhandari is also the part of this presentation.
Yeah, he's also the one of the author and very active member of the CRC, government department. And the whole online process they are looking after. Thank you, Dr. Bhandari, Dr. Bhoja. Next. All the 4 rows, next 4 rows, all come. May I humbly request Dr. Sushma Jain to come on the dais. Dr. Meera Srivastava, one of the invited speakers. Dr. Meera Madam, ex-principal, Government College Long-Term. Dr. Sushma Jain, Head of the Department of Chemistry. She will present memento and certificate. Honorable Dr. Meera Srivastava, the invited speakers. She is a well-known figure, not only in Bikaner, in the field of कॉलेज के बच्चे हैं तो हम हैं you see the camera? No problem. Please. Dr. Madhubala ma'am is also online. Ma'am, these are all the students. Dr. Madhubala ji. Dr. Madhubala ji, they all postgraduate students of Dungar College, Basic College.
Wonderful.
They
Wonderful.
all
It's such a pleasing experience to see the budding scholars at Dungar College, Bikaner. Wish you all the best.
Thank you, ma'am. They are attending all the seminars this morning for last 3 days. They are presenting Memento certificate like the speaker.
Excellent. This is an excellent show.
Please sit down.
Dr. Bhupender Singh, is he still online?
Yeah, madam, I can see you. Very happy to see you.
Very pleasant. You know, COVID has bound us to be away.
Yes. The same here, you know, I have not been attending office since last 10 days.
Oh, I see. But many thanks. You could be online with the conference.
I wanted to have a presentation also, but couldn't go to office. That's the reason I had to cut it.
We all understand this.
Happy to see you, madam, and congratulations on the felicitations of lifetime achievement.
Every request,
Thank you so much.
Sharma, Dr. Anila Purohit, come on the dais. Dr. Anila Purohit, she is one of the particular of this ICRP interesting conference. Without her support, I could not organize this conference. It would have not been possible for me. Dr. Anila, come on the dais.
Dr. Anila Purohit.
Yeah, ma'am.
She deserves bigger applause than Dr. Rajendra Purohit. Because Dr. Purohit is getting his due as Secretary ISRB. Yeah. Madam is doing it without any recognition. My hearty congratulations to you.
Thank you, madam.
Pleased to see you. Pleased to see you. I wanted to be there, but it hasn't been possible.
Yes, we are missing you.
Thank you.
Thank you once again.
I would request Dr. Leela to present a certificate and memento to our chairperson, Dr. M.D. Sharma. Untitled Sharma, Professor Head, Department of Physics. Department of Physics. Yeah, I would request again Anila and Dr. Dipti ma'am to present the certificate and memento to one more chairperson, Sumanlata Tripathi. She is professor of botany. Anu Sharma sir, you also be with us. Dr. Madhubala ji, our faculty member, Dr. Anu Sharma sir, is working hard in getting memento. His wife Suman Tripathi, geology botany pair.
Very good, very good. Hearty congrats.
Thank you, ma'am. Thank you. Sumant Tripathi ma'am, heartiest congratulations. Thank you, sir. We can leave the hall only for 5 minutes because.
Dr. Purohit, मेरा memento आप अपने पास रख लेना.
Sir, I will sign the memento and the certificate along with food package.
हाँ, मैंने तो आपने announce
all the speaker and chairperson. I promise Dr. Madhubala, I will send. For tomorrow on, we will send it to you.
Okay. Bye.
Sometimes it was found that when we go for tea, we take half an hour. Don't take half an hour. The hot kofta is there. We go outside, have a cup of tea. Our chairpersons are there, Dr. Vishnu and Dr. Palicha. They will take the session. Dr. Dina Saha is here.